Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about care of invasive lines. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the topic. The learning objectives we will be discussing in this session will be: what is an invasive line? What are the common vascular lines? Care of patient with peripheral venous catheter, central venous catheter, peripherally inserted central catheter, and arterial line. Let's get into the session. So, what are invasive lines? The term invasive lines refers to medical lines or devices or tubes that are inserted into the body in order to administer fluids or drugs, to drain the content, and to monitor functions. Here, we will be discussing on care of common vascular lines. They are peripheral intravenous catheter, central venous catheter, peripherally inserted central catheter, and arterial line. These lines are commonly called vascular access devices. There are other vascular lines, for example, pulmonary catheter and dialysis lines. But here, we will be focusing on these four mentioned first. Let's start with peripheral venous catheter. A peripheral intravenous catheter is a thin plastic tube inserted into a patient's bloodstream through a vein in the periphery of the body, typically in the hand, arm, or forearm. It is used for various purposes including hydration, drug administration, and blood transfusions. Why is carrying peripheral line is important? First is infection prevention. Proper care of a peripheral IV line helps prevent infections at the insertion site and bloodstream infections. Next is patient safety. Patients rely on peripheral IV lines for the administration of medications, fluids, and blood products. Ensuring the safety of these lines avoid complications and discomfort. Next is minimizing complications. Peripheral IV lines can lead to complications such as infiltration, phlebitis, etc. Proper care helps minimize these risks and reduce the need for line replacements or additional procedures. Next is venous access maintenance. Peripheral IV lines provide the primary or only means of venous access in some cases. Maintaining these access points is crucial, especially in cases where repeated venipuncture is challenging or painful. Next, we will be discussing about the care aspects of peripheral IV line under 5 headings and not the procedure. Following 5 headings are assessment, scrub the hub, transparent dressing, use of extensions with closed system, flushing, and locking. Let's discuss this one by one. Under assessment, first comes pain. Pain assessment and scoring is done by using PQRST. This we have discussed in one of our previous video and the link is given in the description box. This assessment helps to quantify the intensity of the pain level of patient and plan for further interventions. For example, if the patient is experiencing severe pain at the site, it means resite the cannula. Next comes redness. Carefully observe the area of redness to determine if it is localized or spreading. Monitor for any other signs of complications such as swelling, pain, or fever. Next is inflammation. Inflammation around an intravenous cannula site or the vein should be assessed. IV cannula inflammation is characterized by redness, swelling, warmth, tenderness, and discomfort at or near the insertion site. Next is discharge. Fever might be caused because of infection at the IV site, which can cause discharge that may be purulent, that is pus-filled, and accompanied by redness, warmth, and tenderness. Infection can occur when the IV insertion site is not properly cleaned and disinfected or due to bacterial contamination. If infection is suspected, the IV cannula should be removed immediately. Next comes patency. Patency refers to the unobstructed flow of fluids through the IV cannula, and it is crucial to check once in a shift in order to ensure that it remains open and functional for the safe and effective administration of medications, fluids, or other treatments. Next comes date of insertion. Recording the date of IV cannula insertion and its duration are essential for patient care and safety. Recite the cannula according to your institutional policies or use clinical judgment. The Visual Infusion Phlebitis VIP scale is a widely used tool for assessing and grading the severity of phlebitis, which is inflammation of a vein often caused by the presence of an intravenous catheter or cannula. So for what we have discussed is all about assessment, and now let's see what is scrub the hub. Scrub the hub refers to the practice of cleaning and disinfecting the access port or hub of a medical device such as an intravenous catheter or central line. What is a hub? Hub refers to the end of the catheter that connects to the blood lines or infusions. Why is scrubbing the hub important? Catheter hub is a known source for catheter-related bloodstream infections and needleless connectors or sources for microbial contamination. So, scrubbing the hub is important. When to scrub the hub? Scrub the hub prior to accessing the line to administer medications, fluids, flushes, or blood draws. And how do we scrub the hub? Perform hand hygiene, wear gloves, use chlorhexidine or 70% alcohol swab, and scrub the hub in a twisting motion for 15 seconds. Allow the hub to dry for 15 seconds. So total 30 seconds. After that, the hub can be accessed with sterile devices for infusing medication or drawing blood. Next comes transparent dressing. Vascular access devices should be secured with transparent dressing. Here, in this picture, peripheral IV line is secured with transparent dressing. Why is it important? It is because, for protection, transparent dressings act as a barrier that protects the vascular access device insertion site from contamination that could lead to infection. Next is visibility. Transparent dressing allows healthcare providers to monitor the site for signs of infection, redness, oozing, inflammation, or other IV complications. Moreover, these dressings are waterproof and easy to apply when compared to any other devices. Next comes use of extensions with closed system. What is the use of IV extension? To prevent catheter dislodgement. IV extensions can help secure the catheter in place by reducing tension and movement at the insertion site. This minimizes the risk of catheter dislodgement, which can lead to IV complications such as phlebitis, bleeding, infiltration, or the need for catheter replacement. What is the use of closed system? IV extensions are designed to maintain a closed system. This means that when healthcare providers connect medications, flushes, or additional IV fluids, they can do so without exposing the internal IV catheter to the external environment. A closed system helps to prevent contamination and infection. And now comes flushing and locking. First is flushing. IV flushing. Injecting a sterile solution, typically normal saline or heparinized saline, into an intravenous catheter to clear medications, blood, and blood products out of an intravascular device and into the bloodstream. Why is flushing important? In order to maintain catheter patency, to prevent IV complications such as occlusion, phlebitis, etc., to prevent drug-drug interactions. While administering multiple IV injections, IV flush should be used between injections in order to prevent drug-drug interactions. Now, when is IV flushing done? Before administering injection, after administering injection, and between injections. Now, locking. What is locking? For saline locks or intermittent catheters that are not currently in use but left in place for future access, it is typically recommended to flush them with saline and lock them after each use, usually every 8 to 12 hours to maintain the patency of IV and prevent occlusion. So, these 5 topics which we have discussed will be useful for the nurses while taking care of patients with any of the vascular access devices. A central venous catheter, also known as a central line, is long, soft, thin, hollow tube that is placed into a large vein that ends in cavo-atrial junction. A central line catheter comes with multiple lumen named as proximal, distal, and medial. Now, why central line care is important? First one is infection prevention. Proper care is essential to prevent central line associated bloodstream infections, that is CLABSI, which can lead to serious complications, sepsis, and increased patient morbidity and mortality. This includes CLABSI care bundle. Then, maintaining venous access. Central lines are essential for various medical interventions including the administration of medications, parenteral nutrition, hemodialysis, and frequent blood sampling. Adequate care ensures the longevity and functionality of the central line, reducing the need for repeated insertions and preserving venous access. Next comes patient safety. Central lines are often used in critically ill patients, those requiring long-term intravenous therapies. Ensuring the safety of these patients is paramount, as complications related to central line can lead to severe illness, prolonged hospital stays, and increased mortality. Now comes central venous catheter indications, and this include volume resuscitation, emergent venous access, nutritional support, inotropes and high-risk medications, hemodialysis, and CVP monitoring. Next is insertion sites of central venous catheters. The sites where central venous catheters inserted are internal jugular vein, subclavian vein, and femoral vein. Care of central venous catheters also include the following: assessment, scrub the hub, transparent dressing, use of closed system extension, and flushing and locking. First is assessment. Under assessment, first comes assessment of pain. This is done in order to identify the intensity of level of pain of the patient and plan for further interventions. Next is assessment of redness if it is localized or spreading. Next, we assess for suture integrity if it is intact and in place. Next is assess for inflammation, which is indicated by signs such as redness, swelling, and the skin being warm to touch. Next is assess for any discharge. Fever can be a sign of infection at the venous site, which could be indicated by discharge, which may be purulent, redness, warmth, and tenderness. Infection mainly occurs at the insertion site if it is not cleaned and disinfected properly, which may lead to bacterial contamination. And next is assessment of patency. Patency refers to the unobstructed flow of fluids to the central venous catheter. Patency is monitored periodically to ensure the unobstructed functioning of the central venous catheter in order to administer fluids, medications, or for other treatments. Next is assessment of date of insertion. Recording the date of insertion of the central venous catheter is important for patient care and safety. And every institution has its own policy for either change or removal of central venous catheter. Next is removal of unnecessary lines. Once the infusion gets over, remove the line immediately and don't keep the empty line for a period of time in order to prevent backflow. Under care of central venous catheter, the next is scrub the hub. Scrub the hub prior to accessing the line to administer medications, fluids, flushes, or blood draws. We have discussed about scrub the hub in detail in one of our previous videos, and the link is given in the description box below. Transparent dressing. Secure the catheter with transparent dressing. Replace dressings that are wet, soiled, or dislodged. Perform dressing with aseptic technique and use chlorhexidine. Next comes use of closed system extension. As discussed before, central line has multiple lumen, and in critical care, patient may have multiple infusion through central line, so there will be a need of extra lumen for infusion. Hence, select a closed system 2-way or 3-way extension depending upon the number of infusions. Remember, more the number of ports, more the chances of infection. Next comes flushing and locking. What is called central line flushing? Injecting a sterile solution, typically normal saline or heparinized saline, into central line. Why is flushing done? This is done in order to maintain catheter patency, to prevent blockage or clot in the lines, and to prevent drug-drug interactions. When is flushing done? Flushing is done before administering injections, after administering injection, between injection, and after collecting blood samples. Next is locking. IV locking is also called saline lock. For saline locks or intermittent catheters not currently in use but left in place for future access, it is typically recommended to flush them with saline and lock them after each use. And this is done in order to maintain the patency of the central venous line and prevent any occlusions. Next is prevention of CLABSI, central line associated bloodstream infection. These bundles typically consist of combination of intervention and best practices aimed at reducing the risk of infection associated with the use of central venous catheters or central lines. Implementing CLABSI bundles has been shown to significantly reduce the incidence of CLABSIs. What do we mean by peripherally inserted central catheter? A PICC line is a long, flexible, thin tube inserted in large peripheral vein and threaded through the vein to rest above the right atrium of the heart. The other end of the catheter stays outside the body, which has injection ports. Coming to the indications of PICC line. PICC line is indicated in cases of chemotherapy, continuous antibiotic therapy, total parenteral nutrition, and for sampling purposes. PICC line is contraindicated in case of renal failure and dialysis because preservation of upper extremity veins is needed for fistula or graft implantation. Next is insertion sites of PICC line. A PICC line is inserted in a peripheral vein in the arm such as the cephalic vein, basilic vein, or brachial vein, and then advanced proximally towards the heart through increasingly larger veins until the tip rests in the distal superior vena cava or cavo-atrial junction. Here comes close look of the PICC line site. The PICC line is secured with a transparent dressing and it contains a protective disc with chlorhexidine, a securing device, a clamp, and a cap with a closed system. Next comes care of PICC line. While taking care of a PICC line, remember the mnemonic alert where A stands for applying transparent dressing and assess for suture integrity and catheter position. Next is line patency needs to be checked, or the patency of lumen should be checked. Next, E comes ensure closed system is followed always. And next, R stands for re-examine for dress. Here, the mnemonic dress stands for looking for any discharge and redness, ecchymosis, swelling, and signs of systemic or local infection. T stands for time and date of insertion of PICC line and dressing needs to be written and checked periodically. Next comes PICC line dressing. Use a sterile, transparent, semi-permeable or self-adhesive polyurethane dressings. Change the dressing according to manufacturer's recommendations. If the dressing is a transparent, semi-permeable, self-adhesive polyurethane dressing, then it should be changed after 7 days. If it is a gauze dressing, it should be changed after 48 hours. And if it is a chlorhexidine impregnated dressing, it should be changed after 7 days. And also the dressing needs to be changed as and when needed, such as when the dressing becomes damp, loosened, no longer occlusive or adherent or soiled. Next is solutions used for skin preparations while dressing. Alcoholic chlorhexidine is the preferred solution for skin preparation while dressings. Remove skin solids defeating with alcohol or acetone. Remove blood or ooze from catheter insertion site with sterile 0.9% sodium chloride. Next comes sampling from the PICC line. Follow infection control protocols. Scrub the hub with 70% alcohol, that is isopropyl alcohol. Scrub the hub for 15 seconds and allow it to dry for 15 seconds. Discard 10 ml of blood. Take the sample as per the requirement and then finally flush with 10 ml normal saline. Next, flushing of PICC line. Flushing is recommended to promote and maintain patency and prevent the mixing of incompatible medications and solutions. Sterile 0.9% sodium chloride for injection should be used by a clinician to flush a catheter unless the manufacturer recommends flushing with heparin sodium solution. Flush catheters immediately after placement, prior to and after fluid infusions or injections, prior to and after blood drawing. Line should be flushed after dressing and at least once weekly when it is not in use. Always use a 10 ml syringe for flushing in order to avoid excessive pressure and catheter ruptures. Next comes flushing technique. There are two techniques for flushing a PICC line. First comes SASH technique, SASH, where S stands for saline flush first, A for administering any medications following flush, S saline flush after administering any medication, and H heparin flush as the final step. The other technique for flushing and locking is the ACL technique for flushing, that is assess, clear and lock, where A is for assess the status and function of the vascular access device to confirm location and patency, C for clear medications and solutions from the vascular access device to avoid any incompatibilities, L to lock the vascular access device during periods of non-use to ensure patency. The complications after placement of a PICC line includes catheter dislodgement, deep vein thrombosis, phlebitis, air embolism, infection at the site of insertion, bloodstream infection, pain at the site, catheter fracture and catheter migration, superior vena cava syndrome. Next, nurses' responsibilities in carrying a PICC line includes: do not manipulate the catheter, do not touch any unsterile surface after wearing sterile gloves, do not administer medications through without confirmation of the position of the catheter. Check the signs of phlebitis including pain. Assess the site in every shift. Before and after giving medications, follow proper flushing techniques. Remove the unnecessary lines or close the port immediately once the medications is completed. Last but not least, before accessing the ports, scrub the hub.
This is an arterial line.
An arterial line, otherwise known as A line or arterial catheter, is a thin flexible catheter inserted into an artery, either radial or femoral artery, in order to measure the real-time blood pressure with the help of transducer kit connected to the monitor. We have already discussed a video related to arterial line regarding this setup, and the link is given in the description below. In this video, we will be mainly focusing on square wave test. Before that, let's quickly summarize the setup of an arterial line. So, here is the arterial line setup. Arterial catheter is inserted into a radial artery. Transducer is connected in the IV stand at level of phlebistostatic axis. Next, pressure monitoring line is connected to the transducer kit. Next is the pressurized saline bag attached in the IV pole and the IV tubing connected in the other end of the transducer. Next is cable from the transducer is attached to the monitor for measuring the real-time blood pressure. So this is all about the setup. Now, parts of transducer kit. This is the point where the arterial line is attached with the help of PM line. Next comes the stopcock. When we take a close look at the stopcock, there is a word written in the stopcock, off. When we look at the direction in which it is turned, it indicates that the stopcock is off to the atmospheric vent. And this means that the arterial line is open to the transducer. Next to stopcock is the transducer, and next to transducer is the single-handed line flushing. Next comes the point where the pressurized saline bag is attached. And the white line which goes is called the cable, and this is attached to the monitor. So this is all about the parts of transducer kit. So after the arterial line setup and the position of the patient, zeroing of the monitor is done, and then the arterial line waveform is checked in the monitor. Next, let's discuss about the arterial line waveform. Arterial line waveform has three distinct components: the systolic phase, the dicrotic notch, and the diastolic phase. The systolic phase is characterized by a rapid increase in pressure to a peak followed by a rapid decline. This phase begins with the opening of the aortic valve and corresponds to the left ventricular ejection. The dicrotic notch represents the closure of the aortic valve. The diastolic phase, which represents the runoff of blood into the peripheral circulation. This is the normal waveform graph for your reference, and here you can see the systolic, diastolic pressure and the map. Here comes arterial line square wave test. The square wave test is used to assess the accuracy and functionality of the arterial blood pressure monitoring system. The arterial line can measure blood pressure inaccurately unless properly calibrated. So, square wave test helps to identify whether the arterial line is functioning correctly or not. Here you can see the normal waveform, and the other waveform here shows the square wave followed by the normal waveform. Next, let's discuss how do we perform an arterial line square wave test. Perform hand hygiene and wear gloves. Next, activate the fast flush to deliver a bolus of saline solution into the arterial line. This can be done by squeezing the fast flush with 2 fingers as shown in the figure, or rapidly flush the line with a normal saline using syringe. This causes a sudden increase in pressure within the system. Now observe the pressure waveform. If you see the waveform shown here, it is normal. After activating the fast flush, we can observe a rapid rise to a square-like shape followed by a quick return to the baseline. This is called square wave. Now, with this square wave test, what can we identify? Let's discuss. Now, what is a normal arterial line square wave? When we take a look at this waveform after a square wave test, how does it appear? The square wave is followed by 1 to 2 oscillations and returned to baseline. Oscillations in the waveform can refer to the presence of small fluctuations or variation in the pressure waveform following the administration of the square wave flush. Check for oscillations as an indicator of the harmonic characteristics of the system. Now, square wave followed by 1 to 2 oscillations and return to baseline with the dichrotic notch is considered a normal waveform. Next is, what is an underdamped arterial line square wave? When we see the waveform followed by square wave, there are more than 2 oscillations with a fast flush. Also, there is false high systolic or false low diastolic pressures. Next, what is an overdamped arterial line square wave? In this waveform, followed by square wave, there is sluggish or no oscillations with a fast flush, there is absence of dichrotic notch, and there is false low systolic or false high diastolic pressures. Now, being a bedside nurse, a nurse should know that in case of a damped waveform, what are the actions need to be taken. First, let's discuss what are the causes of a damped waveform. The causes include air bubbles in the catheter, blood clots in the catheter, incorrect transducer position, pressure bag less than 300 mg, displacement of arterial catheter. What are the nursing actions need to be taken in such cases? When there is air bubbles or blood clot in the catheter, remove air and clot from the lines. Check the backflow of the arterial line. When there is incorrect transducer position, try to position the transducer at the correct level, that is, at the level of the right atrium. Next is, when pressure bag is less than 300 mg, maintain the pressure bag to 300 mg. In case of displacement of arterial catheter, check the site and position of the arterial line. If there is any malpositioning, inform the physician immediately. Tighten all the connections. Make sure the stopcock positions are correct. After doing all this, if the square wave is followed by 1 or 2 oscillations in the presence of dichrotic notch, this indicates the arterial line is functioning properly. If there is no oscillations or if there is more than 2 oscillations, then inform the physician. One important point to be noted is, depending upon the site of arterial catheter, the waveform also differs. So far, we have discussed what is an invasive line, what are the common vascular lines, and care of patient with peripheral venous catheter, central venous catheter, peripherally inserted central catheter, and arterial line. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.